right, hello and welcome. Good afternoon. My name is Kimberly, and this presentation is in partial fulfillment for the course 5308 Teaching and Learning Strategies. Today we're going to be utilizing the teaching strategy of problem-based learning. I have here some colleagues that will be acting as undergraduate nursing students, so welcome Amanda, Peter, Ross, and Bobby. Thank you for joining me and for your participation. Today we're going to be reviewing and discussing a case scenario that is regarding increased intracranial pressure. So here are the handouts, or the case studies that we're going to be reviewing for everybody. So Amanda. So I invite you all to share your thoughts, opinions, and work together really as a group to answer any questions, solve the problems, and anything else that may arise during this scenario. So the learning outcomes for this lesson are that students will be able to demonstrate their ability to effectively communicate with their peers and work as a team to solve a problem. Students will be able to evaluate patient data and apply critical thinking skills in order to better understand patient diagnoses. And students will be able to analyze the findings presented in the case study and discuss the relevance of those findings. So we're going to start. I'm going to go ahead and read the scenario and then we'll just talk through it. So Miss Olson is a 29-year-old female. She was at work when she had a sudden onset of projectile vomiting and increased agitation. She'd been experiencing severe headaches in the mornings and intermittent diplopia for the past couple of weeks. She was transported to the emergency department, and during that transport, EMS noted sluggish pupil response on the right. This patient lives with her husband in a large metropolitan area. She's a second-grade school teacher and teaches students with special needs. In addition, this patient is a type 1 diabetic, however, it's well controlled with the use of an insulin pump. So go ahead and talk amongst yourself, kind of discuss what you think is most relevant, what's pertinent in the findings that we just talked about.
First thing agitation to me is the headaches.
Projectile vomiting is a lot different than regular vomiting.
Right. Yeah, no
I
joke.
mean, that's pretty forceful.
Right,
Absolutely forceful.
Yeah.
Okay, great. So what of that relevant is most significant, clinically significant to you as the nurse caring for this patient?
I think the projectile vomiting and the visual changes.
Right, that's definitely not normal.
Yeah, I think the noted sluggish right pupil response.
Okay, yeah, for sure. Definitely that's only on one side.
Those visual changes, but then the history of headaches really stand out to me as well.
Mm-hmm. Yeah, we don't know how long she's been having these headaches.
That could be what's causing the increased agitation.
Correct, right. Okay, great. So those are definitely all important pieces of data. So knowing all of this, you're going to go in and assess your patient, and the first set of vital signs you get are as follows. So the patient's temperature is 100.6. She has a pulse rate of 49, respiratory rate of 20. Her blood pressure is 158/82, and she sat at 99% on room air. So again, of those vital signs, what do we think is significant? Is anything off? Anything seem normal? What do you guys think?
Sinus bradycardia.
Yeah, so she's definitely bradycardic. Not too bad, but there's definitely concern there.
You're going to know if she's got a history of that bradycardia, and then if there's a sign of increased intracranial pressure.
Right, she could be an athlete, she could have a history of bradycardia, but not knowing that, we would definitely want to find out. Awesome.
Yeah. What I think is interesting is her O2 stats are pretty normal at 99%.
Yeah.
So her agitation's not because it's hypoxic. So we know it's something greater than just a cardiovascular
Right,
problem.
something else is going on, for sure.
Yeah, and she's definitely hypertensive, so you want to monitor those levels and make sure it doesn't widen.
Yeah, make sure there's not any, progressing changes, it doesn't get any worse, or even the opposite doesn't get too low. We'd want to make sure to monitor that. Great.
Well, with the patient's heart rate at 49, the patient is bradycardic, and there are concerns that her heart rate could continue to drop. It's also known symptom of increased ICP.
Right, so that's one of our first findings, like she's bradycardic, she might have some increased ICPs. Great. Okay, so in addition to the vital signs, you're going to go in, you're going to do a physical assessment. And so these are the findings of the physical assessment. Overall, the patient does appear anxious, as we've discussed, and we are concerned about her neurostatus. She denies shortness of breath, and her breath sounds are equal bilaterally. Again, as Amanda noted, she is sinus bradycardic. She has 3+ pulses throughout, no edema, and again, she's sinus, so her heart rate is regular. Again, neurologically, she's notably anxious, restless and agitated. She has been complaining of those headaches, and she's denying nausea at this currently. Speech is intact, facial symmetrical, however, like Bobby stated, she does have that sluggish pupil to the right, which is important to note. Her abdomen is soft, active bowel sounds, urine is clear, and her skin is warm and dry. So how about this assessment data? What's relevant? What's clinically significant to you as the nurse caring for this patient?
Well, the patient is notably anxious. This could cause problems. It could increase their blood pressure or even metabolic demands.
Right.
Yeah, like I said, with her headaches, the vision changes, sluggish with the right pupil. It seems like it's kind of pointing towards intracranial pressure.
Yeah, another sign that that could be the problem going on for sure.
Like Amanda said, bradycardia could be an indication of the intracranial pressure. I'd be concerned that her heart rate will continue to drop if she may even develop further dysrhythmias if the pressure increases.
Yeah, we want to make sure we keep her on a monitor, make sure there's no changes. Okay, great. So all very important points. So I'm going to go ahead and we're going to kind of talk through. I have some questions of the general case study overall. So again, I know we kind of mentioned it, but I want to ask again, what do we think is the most likely medical problem that this patient is presenting with to us today?
Increased intracranial pressure,
Right.
although we don't know the cause yet.
Right, so in her history, we don't know why, but we kind of think that that's our suspicion for sure. So what's in the underlying cause, pathophysiology that's come to this conclusion that we think this is our main concern?
Well, as the intracranial pressure continues to rise, there's an obvious disruption of blood flow. And if that blood flow decreases, tissues, they don't get enough oxygen and they become hypoxic.
Right.
Your CO2 levels increase and the pH level can drop. So you'd obviously want to make sure this problem's not getting worse.
Yeah, so a lot of pathophysiology going on. We kind of got to keep everything into consideration for sure. Any other thoughts on the causes of why we think this might be happening? Okay. So knowing all of that, what is our primary nursing concern for this patient right now?
Give stats head CT.
Yes, so we want to see what's going on.
Yeah, then you got to continue to monitor the patient's vital signs and cardiac rhythm.
Yeah, monitor them closely for sure.
You need to find out why the patient has that increased intracranial pressure.
Right, we still don't know the cause of it.
Get it treated as soon as possible. It's probably important to monitor the neurostatus, see if there's any changes or trends,
Okay.
and see if we can apply any non-invasive interventions to decrease the pressure.
Right. Awesome. Okay. Any other thoughts? Great. So with that, what interventions would we want to initiate right now based on those priorities?
I mean, the only thing that really comes to my mind is putting seizure pads in the patient's bed.
Right. That's a big concern for sure.
Yeah, try to decrease that risk for, from having the increased pressure causing seizures.
Okay.
Then you also want to assess, monitor the patient's neurostats closely.
Mm-hmm.
And make sure to notify the doctor of any changes.
Yeah, so things can change super quickly. You got to be right there. Notice them. Things can be subtle. They may not be so subtle, but it's definitely important to monitor them closely. Awesome. Okay, so what nursing diagnosis statements would you want to include as your plan of care for this patient?
Ineffective tissue perfusion.
Right.
Pain, anxiety.
Okay. Awesome. And what is the worst possible complication? What would we need to anticipate that could go wrong with this patient?
I mean, the biggest concern that I see could happen would be changes or deterioration in the neurostatus.
Yeah, it could happen quick.
With those intracranial pressures going up, causing seizures, changing, going in and out of consciousness, respiratory depression, etc. Just all kinds of stuff that could go on.
Okay, great. Any other thoughts in regards to what you just said? Okay. So what nursing assessments would you need to identify and respond to if any of those complications did arise or develop?
I think it's why it's important to be consistent and vigilant
Right, for sure.
when monitoring the patient's neurostatus, see if there's any changes, trends, that kind of stuff. Bedside nurse really can make a difference in the outcome in these situations.
Right, and that's our overall goal, right? We want to make a difference in our patient's care for sure. Well, great job, everybody. As we already discussed, it's super important. We want to be really vigilant and very scrupulous about our physical assessments and how we care for these patients. We want to really notice if there's any subtle neurologic findings that could be clinically significant. And as a nurse, one of our primary goals at the bedside is to carefully assess our patients and recognize any of those changes before our patients deteriorate. It's kind of too late to make a change. So, great. Are there any questions or comments? Thank you all for your participation today, and hope you learned something from this case study on increased intracranial pressure.